Hi, everyone, and welcome. We're in the month of June, and the first of the month is marked as National Cancer Survivor Day. We are privileged to be speaking to a very special lady today, Henrietta van Kramberg, whom herself is a survivor of breast cancer. We are privileged to have her share her story with us today. So, without further ado, let's jump right into Henrietta telling us about her survival story of breast cancer, as well as her mental health and the journey that she was on. So, Henrietta, welcome and thank you for speaking with us today.
Thank you so much for having me. And I have to say right off the bat, I love the way you say my name. It means so much. Henrietta means ruler of the world, and I think uh, it served me well. As we mentioned, breast cancer survivor. I'm in year 14 of being in remission. Remission is being declared free of cancer, so I start counting after my last chemotherapy. Um, and that's been 14 years, a journey that I've walked with my friends and family since 2010. I was diagnosed in the year that the World Cup was hosted in South Africa when spirits were high. We even had a name for it. Philip Gies was here, and while South Africa was celebrating, I was diagnosed with this dreaded disease. I remember every single detail so clearly and vividly as if it happened yesterday, because as you know, a diagnosis of this kind is quite devastating. I was at the time 37 years old, and according to my doctor, very young. I fell in love with her when she called me young at that age because I felt that I was already 1 foot in the grave. I was diagnosed in October, which is also very relevant because that is Breast Cancer Awareness Month, and talk was rife about the topic, living healthy, signs and symptoms, etc. So I had gone to a women's event in August where there was a pink bus inside of a building in the Northgate Dome, and inside the bus was a nurse doing clinical examinations. And my sister-in-law Nadine at the time said, "Let's get this checked out because you've been complaining about these lumps in your breast." And I was then diagnosed, or in fact, the nurse did a clinical examination, felt the lumps, felt very concerned, and referred me immediately to a doctor. And that's how my journey started.
14 years. I think people so often underestimate survival journeys, thinking that it's a quick thing or it's just a hop, skip, and a jump, not knowing that this thing becomes a part of you for 14 years, affecting you, affecting your family, affecting the world around you. And I think a great thing is that during that time, there was a lot of talk about it. So you could get information and just having that, oh, let's quickly go and see that. So yeah, every woman out there, if you see a pink bus, please go get it tested, go check, please. Thank you so much for sharing that. It probably must have been really difficult and a difficult path to walk. So, what has been the most challenging moments in your journey? If you don't mind highlighting maybe one or two things that stood out for you on this path.
The challenges I experienced were few and far, and the reason for this is I didn't realize at the time, but having medical aid really made my journey especially seamless. Um, I was with one of the top medical aids in the country, and I had one of the top plans. However, one of the challenges were that even though my medical expenses were covered primarily by the medical aid, there was a 10% gap, um, and a payment gap. And of the 300,000 odd medical bills I had in 2 years, 30,000 of that I had to pay. So that caused quite a stress in my life, as that was not the kind of disposable income um, I had available, or disposable cash that I had available. And so I had a lot of fundraisers, which while you're going through treatment and undergoing your cancer care is not one of the things that you want to really worry about. How am I going to pay my bills? And then, of course, my friends and family, their concern, they were my biggest supporters and cheerleaders throughout my journey, but their concern were the biggest, because we had had a devastating death a few years before that, and everyone was very scared that they would lose me. That was all that was on the minds of my family and my friends. So those were some of the challenges that I faced head on. Um, the other small challenges I could overcome easily because of my support system, which I'm to this day very grateful for.
Having friends, family, and a support system is really such an important cornerstone for getting us through difficult times. And I do think you appreciate that. And I can hear it in your voice as you're talking about your experiences, this very painful experience. I can hear a bit of a laugh, how you're reflecting on how they were there for you, supported you with the fundraising. But even with that support system, I'm sure there was still some other mental, physical, emotional challenges. So, aside for these friends, the support system, how else did you really get through these times? How did you cope?
We always sit around and talk about these things, and sometimes laugh and giggle, because out of all my friends, I was the health fanatic. I was the vegetarian for longer than 10 years. I was the gym fanatic. I was the one not smoking and drinking at all. And then I was the one that got cancer. So cancers are not always hereditary. It's a very small percentage that's really hereditary most of the time. The causes are lifestyle, with what we call lifestyle diseases, for instance, stress or unhealthy living or obesity, etc. These are the things that sometimes contribute to us picking up these dreaded diseases. So there we were, laughing about the fact that the healthiest one amongst us was the one who got diagnosed with breast cancer. So you can imagine, physically, I attempted to continue going to the gym, but because the actual treatment of breast cancer, in my case, out of the 5 types of breast cancer, mine was estrogen receptor positive breast cancer. The kind of chemotherapy that I was given, the side effects that I had was like neuropathy and fatigue that made you extremely tired. Your hands and feet had pins and needles, and many mornings I had to learn to walk from scratch. Um, Physically it does affect you, and I still attempted to go to the gym 2 months after treatment, and then when I'm in the gym 1 month, then I have to go back, because it's a long process of treatment and care. And then mentally, I was a big yoga fan, always have been, of meditating, and talking has helped. With the devastation of a loved one years before that, and then this cancer diagnosis, I've always been a talker, and I've always believed in addressing the issues at hand and the concerns and the uncertainties and the anxieties. My family rallied around me and came and moved into my home in Centurion, and my mom washed me because I couldn't use my one arm. So those were my challenges, mentally and emotionally and physically, but making sure that I had real live solutions right there in front of me at the time helped. There were nights that I would lie around and think, why me? There were times that I've been asked over the last 14 years, but especially in the first 2 years, to do talks. And over, I would say, I would rather not have had this diagnosis or have lost a loved one, There'd be just a nobody in my home if I had a choice. If I had a choice, I would not have gone through this journey that I managed to surpass and um, kicked its butt. I would not want to wish this on anyone because it's still hard, even though you, as people say, get through it with flying colors, or how we refer to ourselves as survivors, because there are so many people that pass on. I remember one fundraising event we had where I met a 28-year-old young lady who had a young daughter. And the next time we had to walk for cancer, she didn't join us because she had then passed away. And I was introduced to another 18-year-old when she was diagnosed. My breast surgeon always would refer these patients to me so that I could walk their journeys with them. And the 18-year-old had a very aggressive breast cancer that she was diagnosed with. And when she was 21, she passed on. So these are the things that stay with you. And although I say I stand here today having survived, it's not easy and we don't take it lightly, but we get through it as best as we can.
Henrietta, thank you so much for sharing that on your own journeys and our own survival journeys. I never realized or thought about that in your attempt to survive, you're also surrounded with so many other survivors that don't get that privilege, that don't get to survive. And all that comes with that, the survivor's guilt, the heartbreak and the sorrow of really being part of these families' lives, and then having them pass and not be with you anymore. So thank you so much for sharing that with us. So into conclusion today, I would just like to say and ask you if there was one thing that you could share with people out there about surviving or adversity or mental health or anything that you would like to share today, what would that be?
So, over the years, I've realized that one person's adversity could be cancer, another one, it could be something totally different, like mental health that's affected adversely, or an abusive relationship, or um, whatever hardship people are going through. I've realized the one thing that we all can take heart in is the resilience that's within us. So when it comes to women, I say be aware of your health. Don't walk around with your eyes closed. And unfortunately, as women, we've been blessed with intuition. So we know when something is wrong long before a medical professional or a specialist tells us. So be aware of your health, mental, physical, be aware. And then once you are aware, take action. I have many, many stories, very close to me even, of people that have felt lumps in their breast, in the case of breast cancer or breast disease even, that have gone for years with the pain and the suffering. One person couldn't hug her children for years because when she held them too close to her chest, it was too painful. So understand your health, know your risks, but also take action. You'll be surprised what you can get through with the help of medical professionals. And once you've actually acknowledged that you needed help, I want to say to people out there that are going through any sort of hardships that we've got built-in resilience as human beings. We've come through so much, and there is so much more that we can get through. We must never underestimate our own power. Sometimes our voice is small, but we have a voice. Sometimes our courage is little. Get up tomorrow morning and try again. I am a little girl from Eldorado Park who never for in a million years thought that she'd ever walk this journey. But through breast cancer, I was even able to climb Mount Everest to base camp number one. If I can do it, any person can overcome hardship. My name is Henrietta van Kramberg, and I kicked cancer's butt in my 6-inch heels.
Woohoo! Go, Henrietta. Yes, you did. You did kick cancer's butt in your 6-inch heels. And I am so proud of you for that. Thank you so much for that beautiful sentiment that you shared with us. And thank you so much for taking the time to talk to us today, to create awareness about breast cancer, but also to talk a little bit about mental health and how we have that built in resilience and how we can overcome adversity if we talk about it, if we look out for each other, and if we build those support networks. Thank you once again. And for the rest of you, please, thank you so much. Go test, go test. Thank you for joining us today. And thank you for listening to Henrietta's story.